June 2012, the Ministry of Local Government and Community Development was asked by the Jamaica Red Cross to co-chair with the Office of Disaster Preparedness and Emergency Management, UNTEM, an advisory committee for a project to conduct research on behalf of the IFRC. The project was to examine Jamaica's laws and policies with a view to assess Jamaica's legal preparedness to facilitate and oversee international relief in respect of goods, personnel, and equipment. The Jamaica Red Cross, with the assistance of the advisory committee, of which I was co-chair with Mr. Ronald Jackson, was the former UNTEM Director General, we selected a legal researcher who is Ms. Tania Chambers, who you'll hear from shortly. And it was agreed that as part of the researcher's work plan, 2 workshops will be conducted in an effort to gather the relevant information from stakeholders. The workshops hosted by the project through the Jamaica Red Cross were most useful, as the participants for the most part were able to provide the answers to the research questions. At the second workshop, Mrs. Isabel Granger, the IFRC's Disaster Law Program Coordinator, was in attendance. A summary of the results of the research was then presented. The information from the participants of the workshop and the research generally was what made it possible to honor Jamaica's commitment to contribute to the regional compendium. As a focal point who has been selected by the ministry to assist in filling out the regional compendium, I want to thank the Jamaica Red Cross for affording the opportunity to participate in this process to better understand our legal preparedness as a country to facilitate international relief during a major disaster. More importantly, the end result of the project, the International Disaster Response Law, Rules and Principles in Jamaica report, is an excellent document which can assist in improving our domestic or national disaster laws. You will now hear from Ms. Chambers about the report. Thank you.
Hi, good afternoon. I think we're still trying to find the presentation that I'm working from. So while the technical person sort it out, just to clarify, some of the background that went into this particular research. Somewhere around 2001, the scope of what international disasters look like, and therefore what international disaster responses look like, really began to change, began to shift globally. A humanitarian response has taken on a much larger frame, particularly from incidents, the most recent one being in Haiti, pretty much next door to us in Jamaica. And so the International Federation of Red Cross and Red Crescent Societies embarked on a process to look at how laws and national systems can better facilitate the influx of humanitarian aid, particularly in that kind of a massive or major event where national systems are at their weakest. In 2007, the countries party to the Geneva Conventions ratified what we now call the International Disaster Response Law Guidelines. And so since then, the Federation of Red Cross and Red Crescent Societies has been working with various countries to study how the IDRL guidelines are reflected in national laws. And so in Jamaica, we have that kind of a study starting last year and into early this year. And it was done, as mentioned before, in collaboration with a number of government agencies and the Jamaica Red Cross. So I am here not just as a member of the panel to speak about the issue, but as part of an initiative to launch the publication that came out of that initiative, which you'll hear more about and hopefully get a copy today. Okay, so in terms of a window into the study, there are 6 sets of issues that we looked at. We looked at relief coordination mechanisms, early warning systems, the initiation and termination of international relief, the legal status of donors, the entry of goods, equipment, and personnel, and the legal aspects of long-term operations, where the nature of the disaster requires, say, something over a year in terms of a disaster response time frame. The idea here is to assess the extent to which our local laws, policies, and legal practices facilitate these various aspects of a humanitarian response. And we were able to look at it from two perspectives. There's one perspective that focuses on those donors that have resident presence. The UN groups, the Red Cross, the local NGOs, and other parties who are, because they have a local office, are part of not just response in the event of a disaster, but form part of your national emergency planning and management framework. The other perspective that we took to the research was, well, what happens to those ad hoc donors, the ones who are not resident locally, but assuming that you have an incident that so overwhelms even those donors resident locally, what do we have in place to facilitate new organizations and just the man on the street watching news from another location who wants to participate in an emergency response? And we found that when we compared, it was apples and oranges, or basically there are two completely different sets of realities, depending on whether you have a local presence or whether you are a new donor who wants to be part of an international humanitarian response post-disaster. And so in terms of our relief coordination mechanisms, we do have a Disaster Preparedness and Emergency Management Act locally, and that's the act that is the basis for our Office of Disaster Preparedness and Emergency Management. In addition to the act, there's the National Disaster Plan and a number of sub-plans falling underneath that, that have basically set up sectoral and community level coordination mechanisms pre and post major disasters. There's also other types of partnerships, in particular those partnerships that would bring in UN agencies and other international development partners and donor groups. And of course, there are special coordination mechanisms in place around military relief. What we found though in terms of gaps is that while we do have a very strong coordination mechanism in place, the mechanisms that we now have in Jamaica are very, very relevant to the types of disasters that we have had in the past. And so we will have machinery that works pretty well around the hurricanes and tropical storms that are an annual event, pretty much. And they match the type or the scale of disasters that we have had in the last 10 years or so. While we do have plans in relation to other types of disasters, so we have, for example, plans in relation to an emergency oil spill or earthquake plans or other types of disasters that are not as routine in our experience. We do find that those are the plans that would perhaps be reflected more on paper and that are less known to the various partners who have to form part of our emergency response. And so to varying degrees, there are other gaps in our coordination mechanism. The mechanisms do exist in practice and in policy, but not so much in our laws or in regulations. There's also that gap between what happens at the coordination level for those agencies who work in the disaster field routinely. And then there are other agencies who only come into play post-disaster. And so for those agencies, the gap that we saw was that their internal protocols and procedures didn't reflect what was in the national plans. And so the effect of this is that once disaster hits, there tends to be part of the work of disaster management has to be to work with the various tax agencies, customs, border control, immigration, etc., to bring those officers up to speed in terms of the actual content of the national disaster plans and what is treated as routine from within the Office of Disaster Preparedness and Emergency Management really isn't reflected in the internal procedures of the various departments who will now have to process various waivers to facilitate the humanitarian assistance coming in from outside. The other gaps will have to do with the levels of participation in our emergency operations. Again, the emergency liaisons in the various agencies would be working together, but sometimes there is a disconnect in terms of the highest levels of decision making in our cabinet. And all of that doesn't mean that we are not able to facilitate international humanitarian aid, but it means that there's more work on the ground to put into effect the plans that really already exist on paper. In addition, integrated reporting and accountability frameworks are not as well developed. And so, post-disaster, how you manage the flow of information to be able, for example, to extract the types of information and value-added studies that the other panelists spoke about is something that we'll have to work on. The issue of accessibility to new donors is another major one. Our coordination mechanisms focus very much on those partners that have a local presence. But for new donors coming in, there would be some barriers. Simplicity and clarity, we have many different plans housed in many different places. And so the persons who know, but the persons who need the information will have some effort in terms of being able to access various waivers and special concessions, etc. The communications interfaces are not particularly strong, again, particularly for new donors. And then, of course, we've spoken already today about standards and ethical guidelines, not just that apply to the recipient, but importantly, those that apply to donors coming in and how they interact with the local population. In terms of early warning and preparedness, again, because of our experience with hurricanes, there is a good bit of documentation here, and there are various types of plans and standard operating procedures, which you'll see referenced in the document. But even with all of that, there's still a certain level of uncertainty inherent in the process. Some of the plans are pretty dated and there's no specific review process. Routine training was another major area of weakness, and so some of the agencies that are involved would need for their staff to have exposure to emergency practices from time to time. And of course, some of that does happen, but we found that this was one area where there was weakness. And then what we found, almost as an aside, was that much of our efforts in terms of disaster preparedness and mitigation would have to do with the short-term activities. But of course, there are some longer-term issues in terms of planning laws and community risk resilience that will have to be dealt with over time. In terms of the initiation and termination of relief, again, we do have clear guidelines for these things, and the declaration of an emergency happens at the very highest level. That is good and bad in terms of the level of buying once an emergency is declared, but the downside of it is that the declaration of an emergency has a broad policy impact on a number of sectors: security, justice, tourism, industry. And so these things are not done. In other words, or to put it another way, the management of the actual impact of the disaster on a given community is only one factor to be taken into consideration. The other factors may mean that the country decides to take a smaller level approach, or a lower level approach, to managing the disaster rather than declaring a national emergency. Just so that, for example, for tourism and industry, there is continuity locally for other income-earning sectors. We do have a pretty robust damage assessment and needs analysis systems, particularly at the community level, but feeds up at every level and of course in the sector levels as well. And there's routine donor coordination that ensures that the priority lists that are developed locally are appropriately communicated to those donors that have a local presence. One of the main weaknesses here is that we do not have standardized processes for initiating humanitarian relief or for the types of concessions or procedures that emerge once you've initiated international relief. And so the same concession may be applied after two types of disasters, but procedures to access the concession may be completely different. And all of that has to do with the fact that we don't have, at the level of our laws, the kind of backing for these systems as are needed. And so they're a bit subject to the management that is in place at the policy level from time to time. And as I mentioned before, we really don't have a proactive mechanism for interfacing with ad hoc donors or new donors or unsolicited donations at the highest level. And so one of the impacts of that is that much of the donations that are received in that way are inappropriate to the needs, whereas the established donors would have the benefit of priority lists and other types of partnerships that will allow them to supply the needs that emerge from a given disaster. The unsolicited donors have no such guidance, and so you get inappropriate donations, which become a drain on the very resources that are supposed to be facilitating international relief. Another area that we looked at was the whole issue of the legal status of donors. Just to say here, we do not have an overarching regulatory regime for donors or for international relief partners specifically. And so a lot of the persons who do have presence on the ground would automatically benefit from waivers and concessions because they fit into certain categories. They may be a registered charity locally. Like the Red Cross, there may be a statutory agency that is granted tax relief status year-round and not only post-disaster, or the Salvation Army or the Adventist Development Relief Agency. Those are some agencies that would benefit from existing concessions. The UN groups and other diplomatic groups, of course, would have those concessions as well. But for a new donor, interacting with the system after a major disaster, this would be one of the areas that we have, the greatest limitation in our system. And so, in terms of the entry of goods, equipment, and personnel post-disaster, if you fall into the category of a donor that does not have a local presence, this would be where there is the biggest difference. And so we find that outside of partnership with agencies that have a presence on the ground, there is then that initial hurdle of how do you get the relief into the country. Of course, for major disasters, we have had the practice where the waivers that exist eventually smoothly facilitate the influx of relief. However, again, because the communication mechanisms are not always clear, what tends to happen is that unsolicited donations get mixed in with the types of relief that are really necessary on the ground. And so there have been issues related to that. I'll just go quickly to some of the overarching findings. And of course, as I mentioned before, the document will be available after my presentation. So some of the nuances you can, look through, individually. But to summarize, many of the waivers, exemptions, and expedited processes that are recommended by the IDRL guidelines can be implemented locally, but they're not necessarily captured in law, even though we do have a disaster act. It is really at a very high level and doesn't give the kind of details in terms of what ought to be available or accessible. Our disaster analysis systems are very robust at this time and really ought to remain at the core of the initiation of relief. One of the questions that we asked is if government were to be particularly hampered, what aspects of the relief system would remain effective? And this is one area where, because of the level of training and activation at local and community levels, it was felt that there would still be a process for the damage assessment even even if our government is not able to coordinate it. We do have well-rehearsed coordination mechanisms locally, and we have quite a few plans, but of course there's a need to ensure that these are reflected in laws. For donors that do not have a local presence, partnerships, a clear process for partnering with local donors and or with local government agencies, such as ODPEM, in the wake of a major disaster, should be very clear. And for new donors seeking to be a part of our system, the process of regulation and accountability should also be clarified. Communication with donors large and small is one area that needs to be worked on. And one particular area that was particularly weak for us in terms of our disaster planning was in the area of pandemics. We have plans that cover a wide range of issues, but for pandemics, or the only area in which we have a sector plan is in the health sector, specific to the royal hospitals and clinics, but in terms of a national plan of action for dealing with a pandemic, that's something that is currently in the works. So that is really very short summary of the findings, and I'll hand over.
By our previous two presenters. I, on behalf of the Jamaica Red Cross, thank all partners and stakeholders who facilitated our end product, the IDRL manual. Through their involvement as members of the advisory committee, key informants are simple responders to our queries. We are pleased to have been able to deliver this product and invite agencies and groups to read it carefully and to provide feedback so the recommendations may be able to be enforced. And if we in Jamaica should ever find ourselves in the situation of needing international assistance in a disaster, there will be adequate regulations and laws to ensure swift and safe humanitarian assistance to the vulnerable people. Thank all who contributed, and I now declare that the manual is officially launched. It is available, copies are available outside, both in manual, in the hard copy, and in digital copy, free of cost. Thank you very much.